We did a joint paper a little while ago, and be a little bit out of date, the stats now, but we found that out-of-pockets were one of the highest and fastest growing things in the health sector. Now, I should say, Carolyn, not just in private health insurance, but right across the market. So, for example, if an individual goes to a GP clinic on the weekend, they often have to pay $90 or $100. That's a lot of money. Bulk billing is not everywhere, so that means that person's got an out-of-pocket. Sure, they can put in a Medicare claim, but they won't get 100% of it back. We've seen health insurers move to bigger excesses, $250, $500. Recently, more common is $750. So to buy an excess or a copay is, you pay the first $500 or $750 when you go into hospital. What's the driver of that? I guess it's partly market. My health insurance, I just got the bill, is for a Silver Plus family policy is just over $8,000. They could market it to me a little bit better if or at a lower price if I'm prepared to take a higher cost. Of course, when I go to hospital, I pay a bit more. So I think there's a multitude of reasons. The sad one is it's probably the way the market is working to people least able to defend themselves. When we want to play a risk game and we pass the risk around and pass the cost around, you pass it to the person who can't pass it off. So out-of-pockets are an easy place for it to go, and we're seeing that at the moment. It's being pushed up. Francesco, you might have some comments on that.
No, I think this is very good question, Caroline. Very good call, Andrew. I invite everybody to share their experiences overseas. I would have to say that when you think about insurance, really, you think about different ways in which out-of-pocket payments may even be beneficial. When you think about out-of-pocket payments in isolation, and you think of them increasing, or you observe them increasing, I would say that it's a little bit different, the proposition or the problem. I would say that the rise of out-of-pocket costs in and of itself, if detached from insurance products, and we call them excess here, I think that is of a concern, because it really creates, if you think of what individuals pay to access, for example, healthcare services, so there is no insurance really there. If those go up, for example, to access GP care, that's a concern, that because it really creates an equity problem, right? Who can pay may go to a GP, or otherwise the system entry point becomes emergency, which is not necessarily efficient. Now, so in and in itself, I think looking at out-of-pocket needs to be done in pondering what we really mean by out-of-pocket payments. Because if built into insurance products, it might be a good mechanism to deter moral hazard, right? So we have to be careful also on the level of out-of-pocket payments and so on. Certainly, increasing out-of-pocket costs in and itself is concerning, because it raises equity issues, and there are better ways to organize this. And insurance, even voluntary insurance, is a way to do that. And look, I mean, putting out an idea to conclude, perhaps, and then giving back to Andrew to the final remarks. One of the questions when I came the first time in Australia really surprised me of this model is that we couldn't, for many reasons, really allow GP care costs that are not covered by Medicare to be, covered by private insurance at all, right? So that is clearly a superior pooling mechanism that pulls together heterogeneous risks to the point that creates almost naturally more equality in the actual, price paid than out-of-pocket payment. So I concluded that my comment on that beautiful comment, Caroline, and all the rest, Tom, Marva, and also Joe Portelli. Thank you. He actually commented, I suppose, to Tom Shore comment by saying that HealthScope, has done that market penetration a few years back. So thank you, Joe, as well. Thank you, Andrew. Closing remarks, Andrew?
I think you just see, I think even Carolyn's question on the out-of-pocket shows how hard the how is. If we in a complex system, if we only change, keeping health insurers to have low premium increases or controlling doctors' costs, it might cause a spiral out in out-of-pocket. So, you can control one area and it breaks out somewhere else. Like when it's almost like stepping on a floor with balloons in it. The bubble comes up somewhere else. So, it's a complex system. So there's a lot of parts to manage. So this how piece becomes very, very challenging. Everyone knows what to do.
Thank you, Andrew, and